Welcome back to CSC Today, the programme from the Palmerston North Community Services Council. And it is time for an interview. Normally this is the part of the show where we interview a member organisation, but we're going off topic. And we are going to interview someone who is not a member, but maybe in the future, we'll see. This is David Hill. Hello, sir.
Good morning.
Hi.
Now, David, you are here because CSC members at the last membership meeting, I think, or one before that,
yep.
Got to hear from Andrew Nolan, who's sitting in the cheap seats at the moment and will
Observing.
not... Yes. Heard from Andrew Nolan about a thing called the Health Hub, or the Health Hub project, and you're here to drill down a bit more into that and help us find out more,
okay.
because
Look forward to that.
I admit to having missed the boat completely on this one, and hearing Andrew talk, it sounds amazing. Mm-hmm. So, for people like me a couple of months ago who didn't have a clue, what is the Health Hub project?
In one word? One word is different.
Mm.
The main reason for doing this is, with my years of experience now in healthcare, is the realisation, and in particular in New Zealand, is that what we're currently doing is not working. The main reason it's not working is because the doctors doing the work are stuck in I call it a little white room for 8 hours a day and seeing patients every 15 minutes, which is not satisfactory for the doctor, and I think it's certainly not satisfactory for the patients. And of course, the older our patient community gets, the more difficult it is to actually deal with the number of items, the number of issues they come with in 15 minutes is an impossibility. So it's unsatisfactory. There's lots of other reasons too, and for me, one of the main reasons is that we are not dealing with the issues that drive poor health. In particular, the diseases of poverty, poor education, poor housing, poor nutrition. And in 21st century New Zealand, we should not be dealing with that. We should not be seeing cases of rheumatic fever in Palmerston North at this time in our development as supposedly a developed country. We're seeing diseases of poverty, third world diseases. It's not an acceptable thing. So it's not just about trying to deal with health issues, the day-to-day seeing patients, is also trying to look at how we can deal with the issues that drive poor health. Unless we look at the issues that drive poor health, we'll fail.
You are evidently passionate about this, and this is evidently a cause worthy of attention. I guess I'm surprised that this is happening in Palmerston North. Is this a national movement? Is there significant support for this? I mean, it sounds like there should be.
It just happened to be that we were in Palmerston North. Mm-hmm. But having said that, my family originated from actually when they settled in New Zealand, they settled in Woodville. That's pure coincidence. I didn't realise that when we actually settled in this area. So in fact, I've ended up about, I suppose, about 5 k's as the crow flies from where my great grandfather died.
But not as you can drive anymore.
No, certainly not. I think. Is there interest in this? There is a recognition. I've just come back from the College of General Practitioners conference in Dunedin, and there's no doubt that there is a feeling, a sense of movement that what we're doing isn't working. The drivers of this are exactly as I talk about, the fact that we have a population who are getting older and a population who are poor, basically, and we're not able to deal with that. But the other thing that's driving that change dramatically, and probably drive it more rapidly, is our ability to use electronic communications. And certainly, unless we start addressing our position, I suppose, as doctors in a new world of electronic communication where people can access lots and lots of information, where they don't necessarily need to come and see us. Unless we address that and start adapting what we do to that need and that demand, we'll just fade away. We'll be irrelevant. So we have to change.
So we recognise that we know why this should be. What's the background? What people have come together to make this happen?
I think it's a recognition by a number of people in particular, so Andrew and Patrick Nolan, whose background is in organisational change in education, is a realisation that unless we do something differently, not only in terms of the delivery of a service, but actually the way we deliver it. So it's people coming together thinking the way we currently manage our health service is it's an archaic organisation. We run our organisations like the army. You have strict hierarchies. When you have hierarchies, you create silos. When you create silos, you create protectionism, and there's no movement or transfer of information around those. It's an anathema to the 21st century. So what we've got to do is actually develop an organisation that's fit for purpose for the 21st century, that's open, able to communicate, equity of esteem, where everybody's working around the patient and that person in front of you, working at their needs. If you have hierarchies, they can't do that. We have to get rid of those hierarchies. We describe ourselves as an emergent organisation. An emergent organisation would be one of those organisations, if you think of the birds at night where they flock around, they all seem to follow each other. They have how do they communicate that? Well, the answer is we don't really know that, but that's what we should be doing around patients. We want the people working with us to be able to see an issue and know who to bring in at what time and for what purpose, not having to go through layers of referral, just being able to say, this is what this patient needs, this is what I'm going to do, it's here.
How can you do that in such a confined location as Palmerston North, where I assume, somewhat ignorant of the health service, but I assume all the resources required to offer that service are under the control of the DHB, arguably, although not really, underfunded by government in order to provide that service. How will the Health Hub project link in? I'm assuming you're going to have to link in with the existing services.
It does, and one of the drivers of this change, of course, is that, say, 95% of our funding, the funding that government actually pays, goes into secondary and tertiary care. Most of the work happens in primary care, is what we do in the community as community doctors. What we have to do is redesign our health service that actually says, let's distribute the money to where most of the work goes. And the other part of it that we have to do is make sure that the money follows the patient. It doesn't at the moment. And it's when if the money actually sits in little organisations, silos, and it's those silos that control that. And of course, if they've got the money, they don't want to let it go because they then lose their money. If we had the money following the patient, then the services follow that. And what we increasingly have to do is make sure those services migrate away from the institutions like hospitals and come back into the community. So we want more and more of those hospital-based doctors to be working with us in the community, upskilling us so that we can actually take on those more complex patients in the community rather than having them, A, to refer to hospital for specialist treatment, or B, having to go to hospital more often because we haven't managed their sickness, their illness in the community.
And you have that support, you have that commitment from hospital doctors and people managing these resources to make this happen?
When we start talking to hospital doctors about doing that, they're very, very keen. It's a handful. They're the earlier adopters of what we're trying to do. A lot of it still will be silo protection. But the reality is they have no choice. Healthcare has to change. We have to change the way we do things, which means we have to change what we do in hospitals. We have to change what we do in the community.
Have you encountered any resistance so far?
Oh, yes. Of course.
Then you're obviously doing the right thing.
Yes.
You, as soon as you get shakes of the head, then you realise that, I'm on the right track now. Yeah.
Brilliant.
Now, you're talking about sort of employing new ways of thinking. You're talking about sort of electronic communication and things. There is a concern, and I'm sure you're ready to mitigate this and explain it properly, but there will be a concern when people think of, or certainly people like Michelle and I who are expats to this country, when NHS 24 came around, phone up a nurse and they'll be able to diagnose things for you, and that will release the pressure on services. But it was a the service was not as good. There was a sacrifice.
Well,
we do have that.
We do. Oh, right. Okay.
There's a helpline. Yeah.
So this is not that way of thinking. One assumes.
No. What we have to try and do. Oh, look, it's also it's how do you engage people to do something different, and what our focus is, what we have to get people to start thinking about is not about being sick, is actually being well and staying well. So we will continue to get those calls that actually say, hey, I've got whatever I've got, which might be most of what we do at this time of year are people with head colds. But what we have to be able to do is actually say to people how you keep well, or if you've got a cold, this is how you actually prevent it from becoming something worse. So it's a matter of giving information and educating people around exactly what they can do. It's inevitable that they will do this because IT applications, mobile applications, allow you to do that. So what we've got to rethink ourselves, it's almost like taking ourselves. Look, we practice medicine. When people come into a surgery, their doctor's surgery, the only thing that sits there that's different from 200 years ago is the computer. The rest of what we do is the same. Doesn't make it right. It's just we haven't moved. We're probably one of the last bastions of conservatism. We're our own downfall in that. But we have to change. I think what we will be becoming like those doctors 200 years ago, except we'll have better equipment and facilities. We will be giving advice of how to manage your wellness. We're not necessarily going to be dealing with sickness or actually telling patients take these pills and go away, because they're going to be better informed over some things than we are. So we have to be able to facilitate them and help them around the information about what they think their issue is, or actually what their issue is. These are the options. These are the things we can do. This is why we should do it. So it's actually facilitating that exchange of information rather than telling a patient, this is what you've got to do. This is why I think you should do this. So it's changing the way we look at it.
So it's more ongoing support for those with quite complex problems.
Yes.
Now, in terms of looking at it from a patient's point of view, the reason a patient won't go to the doctors is because they can't afford to go. And you're going to be helping with all of those situations like poverty and the reasons behind the sickness. What is the Health Hub doing in terms of charging those patients that go in? And
the reality is the way we're funded at the moment, you can't escape that co-payment. And I think if I had my way, there would be no co-payment. It would be free at the point of delivery. But there would be there's a lot of resistance out there in the medical profession as well as I think in government. And the reason is that the medical profession will say, well, people have to feel as though they're participating and contributing in a financial way to their care. I'm not entirely sure of that argument. Will we continue to charge it? The answer is yes, we do, because we have to. Otherwise, we go bust. The way we've established ourselves is we've set ourselves up as a trust. So it's a charitable trust. The organisation will be partly owned by the trust, 51% of it. So any surplus that's made, 51% of that will go to the trust for the trust to develop programs or whatever that they feel suitable. And one of the things we've been thinking about doing is actually creating our health grants. So it's really a matter of really supporting those people who genuinely can't afford to their doctor's fees. And the trust, the Health Hub project, absolutely adamantly believes that cost should not be a barrier to you coming to care. That's not the only barrier. If you look at all the evidence and data, yes, in New Zealand it is partly a barrier, but there are other barriers to access and really equity of distribution of healthcare. One of those is geography. Why create IFHCs in parts of town which people have difficulty to get to? Yeah. Again, it's a contradiction to what we should be trying to do. We should be geographically located for our patients. So there's lots of reasons why people can't access healthcare. Cost is certainly one of them.
Am I right in saying that as a profession, the general practitioner, the doctor that most of us see in the first instance, is a profession that is getting older? It's not getting the new recruits to the same extent as other professions?
Yeah, there's a sort of a part truism in that. The main truism in Palmerston North, around 50% of our doctors will retire in the next 5 years. So there will be a shortage. The College of General Practitioners are training just up to 200 a year now and trying to get that increased. We still are very, very heavily dependent on overseas graduates. 43% of our workforce are overseas trained. I was overseas trained. And that will probably go down, especially if the Waikato Medical School comes in, to about 30%. So there's still a it could be heavenly, but it's actually a heavy dependency on overseas trained doctors. If, for example, in the Waikato, I think they have 36 psychiatrists, of which only 2 are New Zealand trained. So it's really trying to keep those New Zealand trained doctors. About 50 of those doctors a year go overseas. They may come back, but they do their OE. So and some of those will be lost. So the answer is yes. Our workforce in New Zealand is declining and will fail to meet the demands. And if you think that the main urban areas like Auckland, Christchurch, Wellington will take a large number of those. So centres, rural centres, or semi-rural centres, urban centres like Palmerston North, the East Coast, especially parts of the West Coast of New Zealand, will find it really, really difficult to get doctors.
Do you think that the Health Hub project will sound enticing to younger doctors?
It's certainly, that's what we've got to try and make it enticing. We've got to change the way we work. You know, a young doctor coming into a community practice like the Health Hub project, what they don't want to do is sit there for 8 hours in a white room with 15-minute appointments. It's, if you think that you've got to do that for the next 30 years, well, I'd give up. So we've got to try and make it a much more attractive proposition. The thing that we have to emphasise above all, working in the community as a general practitioner is probably one of the most difficult specialties you'll do. There is probably nothing more difficult because you don't quite know which part of your brain you've got to engage for the next patient. It's the most difficult specialty to do well, and it is a specialty. What we've got to try and do is get those doctors who do understand that, see it as a specialty, to make that working environment great for them to use their skills. They're upskilling. Let's use it. We can't have them sitting in a room for those 8 hours seeing, during the winter, probably about 60% of the people with a cold. It's de-skilling. So we've got to change that. We've got to make sure that there are other people who can deal with that and know when to bring in those higher clinical skills when they're needed.
Is there a danger when, because we will hopefully talk about this shortly, you're going to be moving into Broadway in the near future and offering your services there. Is there a danger that what you're intending to do in the ideology behind the Health Hub project will be hidden behind the fact that most people will just go, great, a new doctor's surgery's opened up because I can't get a doctor anywhere? And if so, how are you going to combat that, or do you get to pick your patients in order to demonstrate the ideology?
Well, the answer is you can pick your patients, but what we do is we take anybody. And certainly we would already have experienced those patients who are dissatisfied with their previous GP or can't get a GP. We've already got those patients. We've got a large number of refugees now in our practice because a lot of other practices find them quite demanding. They are very demanding and we don't get any extra support for taking them on, but they have to have somewhere to go. I think the biggest leap that we've got to try and get patients to engage with is that you're not going to see your doctor. Who you're going to see is a clinical team, and there will be a person in that clinical team that you will engage with. It's that person that will bring in all of those skills that are necessary in order to make sure that what you've come in with is managed in the best way. And there will be lots of people involved with your care. You should have lots of people listening about what your problem is, because each of us as doctors, we don't know the answers. We don't have all of the answers to your problem. So what can we do to make that better is bring in lots more brains to think about what the problem is. So it's getting people used to the idea that what we're doing is actually better than what you're currently getting.
And within that team, they can discuss a a patient
Yes.
amongst themselves, and they may have missed something.
Yes, and in a very open way. It's in a way that enhances care. I worked in the emergency department in Palmerston North for a number of years, and that's what goes on there a lot of the time. If you've ever been into ED where they have that central station where the doctors and nurses sit and everybody thinks you're playing computer games, the reality is what you're doing is discussing what's going on around you. We're talking about patients all the time. It's an education for us all. We learn all the time by doing that. We can't know everything. It's a learning place. And that's what we're trying to encourage. That's what the Hub is about. The Hub is about bringing people together so that we can talk about what's going on for individuals, for patients. And the other part of that is, and this is where I think people become, we're all very transparent as human beings. We want people to be open and honest. What we ask people who come to work with us is to bring everything about themselves. We want a wholeness. We want to know everything about them. Bring your personality. Don't hide bits behind the counter or leave bits at home. Bring everything. If you have a pissed off day, well, be pissed off with us. It's fine. We need that wholeness. It's congruity. And I think what we want to encourage people to do, our people, the community, when they come to see us, is recognise that there's a congruity. These people are whole. They get it. They understand what's going on. And I can see them. They brought themselves. I can be myself here. That's what we want. That's the environment we're trying to create.
Wow. We are almost out of time, but I wanted to ask one more question before we did finish up, and it is quite a tough one, although depending on how quickly you answer it, Michelle looks like she's chomping at the bit as well. But I just wanted to ask you again to get a sense of the reasons and the people behind this project. Does New Zealand have a health service that we should be proud of at the moment on the global stage?
At one level, it's the health service is okay. It's got to change. The thing that we shouldn't be proud of is what drives poor health. We should not be proud of our record on poverty, on homelessness. Around 70,000 people are homeless in New Zealand. We can't be proud of that. We've got the worst homelessness record in the OECD. And we shouldn't be proud of the fact that we're allowing an enormous gap in earnings. We've got the fastest growing gap in earnings between those who have and those who have not in the OECD. That will make health worse. And our health system currently is not geared to deal with that. It has to change.
Go on then, there's time for you.
Mine wasn't as awesome as that question. Mine was just, you've obviously got patients registered with you at the moment. How many patients can you actually take?
We could probably take, when we're currently just about to join with a couple of other practices. Once we've joined with those, we could probably take up to 15,000. When we've joined with those practices, we will be around 8,000 people. But with the way the model works, we will greatly increase our capacity. And certainly being in Broadway will help us enormously.
I've just realised that I was going to ask Andrew something at the membership meeting and never got round to it. And we're going grossly over time now, but what the hell. One of the big issues, I think, with the health service in New Zealand in terms of accessibility and the freedom to use it is dental care.
Yes.
Does the Health Hub project have any plans around ease of access to dental care?
Certainly we do. We would believe, we'd like to think that we can actually facilitate access and possibly also to free dental care. That's going to be about working with our other collaborators in the community. We have discussed about whether or not we have dental chairs in the hub in Broadway, but we at the moment probably don't have the capacity to do that. But there may be places where we can do that. And we've already started talking to dentists about providing some of their time free so that we can do that work.
So it is on the radar, basically.
It has to be.
Yeah.
It has to be. Our dental health is appalling.
It is, yeah.
David Hill, thank you very much for coming in today and explaining this Health Hub project in such detail and very eloquently as well, I might add. If there are any questions around this or people want more information, what's the best way to get in touch with someone from the Health Hub?
Well, they can either call it. Certainly, the website would be the best place to go. It's got the contact details. So it's HHPNZ, Health Hub Project New Zealand. It'll be the first thing you hit.
Marvellous. Thank you very much for coming in.
Thank you.
I think once you get into those premises on Broadway, we might get you back and just talk about it.
That'd be great.
Keep it on
Yeah,
the
that'd be
radar.
great. Thank you.
Only if you're a member of CSC, though. Thank you very
What
much.
can I say? No, thank you. Thank you for the chance.